Imagine waking up one day and suddenly struggling to remember how to brush your teeth, or forgetting the names of people you've known for years. Maybe your hands tremble when you try to hold a spoon, or you feel disoriented in your own home. These are just a few ways encephalopathy can affect someone's life. Encephalopathy is a broad term that refers to brain dysfunction. It's not one single disease, but rather a condition that can result from many causes, like metabolic issues, infections, toxins, trauma, or even vitamin deficiencies. In this video, we'll explore how encephalopathy impacts daily life and how occupational therapy plays a vital role in helping people regain independence, function, and dignity. To understand how encephalopathy affects daily life, let's look at 4 key areas of the brain that play a major role in function and behavior. First, the frontal cortex. This is your executive center. It's responsible for planning, decision-making, impulse control, and voluntary movement. When encephalopathy affects this region, people may struggle with organizing tasks, regulating emotions, or initiating basic activities like dressing or cooking. Next, we have the hippocampus. It's in the temporal lobe. It's the brain's memory hub, and it's used for forming new memories and navigating space. If someone has damage here, it can lead to forgetfulness, disorientation, and difficulty learning new routines, which can severely impact independence. Next, there's the amygdala. It's part of the limbic system, and it processes emotions such as fear, stress, and pleasure. It can cause mood swings, anxiety, or inappropriate emotional responses, which makes social participation and self-regulation more difficult. And then there's the brainstem. It controls vital functions like breathing, heart rate, and sleep cycles. Encephalopathy here can be life-threatening, and even mild dysfunction can cause fatigue, dizziness, or altered consciousness. Each of these structures plays a unique role in how we think, feel, and function. And when they're compromised, occupational therapy becomes essential, not just to restore ability, but to rebuild identity. The word encephalopathy literally breaks down to mean brain disease. But it's not just about the brain. It's about how the brain's dysfunction affects everything else. People with encephalopathy may experience confusion, memory loss, difficulty concentrating, tremors, changes in personality, or even seizures. These symptoms can be sudden or gradual, and they vary depending on the underlying cause. For example, someone with a metabolic encephalopathy that could be linked to liver failure might have drowsiness and disorientation, or someone with a vitamin deficiency linked encephalopathy such as Wernicke's encephalopathy might have trouble walking or moving their eyes. But regardless of the cause, the result is the same. The brain isn't working the way it should, and that has a ripple effect across every part of life. So how does occupational therapy fit into this picture? Occupational therapists are trained to assess how medical conditions affect a person's ability to perform everyday tasks, what we call occupations. These include self-care, work, leisure, and social participation. To understand the impact of encephalopathy, OTs use a variety of assessments. For cognition, we might use tools like the Montreal Cognitive Assessment, or also known as MoCA, to evaluate memory, attention, and executive function. For motor skills, we might use the 9-hole peg test to assess fine motor coordination, or the Berg Balance Scale to look at stability and fall risk. We also assess how someone performs activities of daily living, like dressing, bathing, and cooking. Using tools like the Barthel Index or the Canadian Occupational Performance Measure, which helps us understand what's meaningful to the client. Sensory and perceptual assessments, like the sensory profile, help us identify how the brain is processing information from the environment. These assessments aren't just about scoring. They're about building a holistic picture of the person's abilities, challenges, and goals. They guide our interventions and help us track progress over time. Encephalopathy doesn't just affect the brain. It affects the whole person. Let's talk about occupations. These are the meaningful activities that people do every day. Encephalopathy can disrupt all of them. In self-care, someone might forget the steps to get dressed or struggle with balance while bathing. In productivity, they might be unable to concentrate at work or manage their schedule. In leisure, they might lose interest in hobbies or feel overwhelmed in social settings. Client factors like cognition, emotional regulation, muscle tone, and coordination are often impaired. That means the person that may have trouble initiating tasks, following through, or adapting when something goes wrong. But it's not just about the person. It's also about their environment. A cluttered home, loud noises, poor lighting, or lack of caregiver support can make symptoms worse. And context matters too. Cultural expectations, financial resources, and social roles shape how someone experiences illness and recovery. For example, a parent with encephalopathy may feel guilty or frustration about not being able to care for their children. And as occupational therapists, we consider all of these layers. We don't just treat symptoms, we support the person in their real-world context, helping them engage in life in ways that matter to them. Once we understand how encephalopathy is affecting someone's life, we can begin intervention. Occupational therapy focuses on restoring function, adapting tasks, and supporting participation. That might mean cognitive retraining, using memory aids, routines, and problem-solving strategies. It might mean practicing ADLs with adaptive equipment like grab bars, reachers, or visual cues. We also modify environments to reduce sensory overload and improve safety. That can include simplifying the layout of a room, labeling drawers, or using calming colors and lighting. Caregiver education is another key piece. We teach families how to support their loved one without taking over, how to communicate effectively, and how to manage stress. Recovery depends on the cause of encephalopathy. Some people improve quickly with medical treatment, while others may need long-term support. But no matter the timeline, occupational therapy helps people regain control, confidence, and connection. Encephalopathy is complex, and it can be frightening, but it's not the end of the story. Occupational therapy offers hope, not just by treating symptoms, but by empowering people to live fully, even in the face of brain dysfunction. By understanding how encephalopathy affects function and by using thoughtful, client-centered strategies, we help people rediscover their abilities, reconnect with their roles, and reclaim their lives. Because in the end, it's not just about the brain, it's about the person, and every person deserves the chance to thrive.